Chapter 3 is another introductory chapter. It doesn't have any diseases and disorders. It's really meant to help orient different conditions within the body. So it's going to include directions as well as planes, certain positions that a healthcare professional would need to know to put a patient in, as well as regions and quadrants, so that when one doctor talks to another doctor and they use one of these directional terms, everyone is on the same page. Directional terms are really used whenever you are trying to relate one part of the body to another. Maybe it's one organ in relation to another organ, or a structure in relation to another structure, then you're going to use a directional term. An anatomic plane is used to identify or look at certain organs or anatomical structures. Oftentimes when you would go in for some kind of diagnostic imaging, they will take a picture in a certain anatomic plane. And the last is body position terms. Again, this would be if a doctor was communicating to a nurse on how he wanted the patient to be situated for a certain procedure or surgery. The regions and quadrants of the body kind of have two different purposes. Regions is really for when a patient describes their signs and symptoms, and they're describing where within the abdominopelvic cavity their pain might be per se. We also have abdominopelvic quadrants, and of course quad, think 4 different quadrants, and basically you just divide the entire midsection of the body into 4 equal quadrants with a vertical line right down the midline and a horizontal line across where the belly button or umbilicus is in the crosshair of that T. If you've had Anat and Phys before, then you should be familiar with anatomic position. This is the standard position to which every medical professional uses as a reference. So a person would be standing or laying, and their palms are facing upward. So it doesn't matter if the patient is standing or lying down face up, these directional terms are going to be used in the same way. Also, your feet are probably shoulder width apart when you are standing with the toes pointed forward. So first we're going to look at the combining forms that are associated with directionality. And then these combining forms are going to be put together with a few prefixes and suffixes to give us all the different directional terms we'll be using throughout the textbook. Here are the combining forms for directional terms. The first is antero. Antero means front. But don't be confused, there's another term on this list that also means front, ventro. Ventro means belly. Sometimes these words are used interchangeably, and we'll find out more specifically in context later on in different chapters. We also have dorso, which means back, but we also have postero, which means back. And usually we're going to have antero and postero used together, and dorso and ventro used together to mean front and back. Other terms, caudo. Caudo means tail, so usually this means downward or away from the head. Cephalo means head, so this would be upward or something that is toward the head. Disto, think distance, so it is away. Infero means below, think inferior is below. Latero means side, so for example your lats, your muscles, are on the sides of your body. Medio, think middle, is down the midline of the body. So latero and medio are going to be used whenever you're talking about one organ in relation maybe to another organ. Proximo is the opposite of disto, so proximo means close or near, and really near in relation to attachment of the body. So if it was, let me give you a bone example, your humerus is proximo compared to your radius. meaning that it's closer to the midsection of your body. Supero is the opposite of infero. Supero means above. Take a moment, look at exercise A on page 65, just to put those combining forms in practice with some pictures. There's only a few prefixes and suffixes in this chapter, and you probably already know the prefixes from your life up to this point. Bi means to, so think bicycle, or in this case, if I make a word like bilateral. We already learned on the last slide that lat means side, so bilateral would mean pertaining to both sides. Uni means one, so if I said unilateral, then it would mean pertaining only to one side. So if you had pain on one side versus both sides of your body. The two suffixes are ad and ior. Ad means toward. So if I said cont'd, cod means tail, so cont'd would mean toward the tail. Ior is another one that we can tack onto our list, meaning pertaining to. In the last chapter, we learned IC, AL, and OUS all mean pertaining to. So this is another one. And technically you can use them interchangeably in the words, even though your book has one specific one. So for example, if I said posterior, postero means back, so posterior would mean pertaining to the back. But if you said posterus, posteric, posteral, those are technically correct words, even though it's not the common medical use word. Now we're going to begin to put together the word roots with the prefixes and suffixes to make these directional terms. Again, there are no diseases in this chapter. It's strictly directions, planes, and positions to help you orient within the body. This chart is on page 67. The pictures are really helpful. Again, keep in mind that they are using anatomical position. So the person is standing erect or laying down face up, and the palms are facing up. Anything that's going towards the head would be cephalid. Away from the head, meaning towards the tail, is cont'd. Lateral would mean away from the midline of the body, medial toward the midline. And the midline is just that imaginary dotted line if you cut yourself vertically in half. As I mentioned before, unilateral would be pertaining to only one side, whereas bilateral means pertaining to two sides or both sides of the body. Other terms, distal would mean away, usually from attachment of the body, and proximal meaning toward where the limb attaches to the main part of the body. Here we have inferior and superior, which means below or down and above. And similarly, you might see cephalid and cont'd used interchangeable with these as well. Here we have caudal and cephalic. Notice how the endings are different, but they both mean pertaining to. We have anterior and posterior, which means front and back. But we also have dorsal and ventral terms as well. So the anterior and ventral are sometimes used interchangeably, and posterior and dorsal are sometimes used interchangeably. Other words that are a little bit tricky is anteroposterior and posteroanterior. And they're pretty much the same word. The word roots have just been flip-flopped. And what it means is pertaining to, which is where the IOR comes in. And then when you go to the beginning of the word, anteropostero would mean pertaining to the front and the back. And the other is pertaining to the back and the front. These two terms are going to be used when you are most likely taking a chest x-ray to denote in what direction you're going to take this x-ray. And you'll notice in parentheses there are the abbreviations. This is an example picture of a person getting a chest x-ray. So in this case they have the front of their chest facing away from the machine, and the picture is going to be taken through the back to the front. So we would use the term postero-anterior in relation to this chest x-ray because it's going from the back to the front. If the person was facing the other direction and the image was being taken from front to back, we would use antero-posterior. Now that you've learned the directional terms, we're going to move on to anatomical planes. And this is important mostly for imaging purposes. So if a person's going to get a CAT scan, MRI scan, a few other different types of scans, usually images are taken as a slice image in a few different planes. And so that's why we are introducing these to you now. This chart's on your book on page 73. And described on page 72. The first major plane is the frontal plane. It's also called the coronal plane. Either one of those terms can be used interchangeably, but it's basically you are cut in half, so you have a front half and a back half, or if I'm using technical terms, anterior and posterior half. Another type is a sagittal, and so a sagittal plane is basically any vertical plane where you have a right and a left half. There are different kinds of sagittal planes. If you have a mid-sagittal plane, well, that means you are cutting right down the middle and you have an equal left and right side. If you have a parasagittal, then that means you're cutting anywhere that's not the middle, so you have an unequal right and left side. The book kind of has them divided into three different categories. Sagittal is the general term, and then you can either have a mid-sagittal plane or a parasagittal plane. The last one is transverse. So this is if you cut the body and you have a top and bottom half, or superior and inferior halves. And this can happen anywhere along the vertical line of the body. Body positions, and these are not built from word parts, so you're going to have to straight up memorize them. And some of these are eponyms, meaning they are named from the person who discovered or invented this particular position. So they're going to be a little tricky. They're not really intuitive or go with the action that's taking place. The first position is the Fowler position, and this is where you are in a semi-seated position and your knees are slightly elevated. So this particular one is used oftentimes on a stretcher, for example. The person is, not in a 90-degree angle. So they're kind of leaned back a little bit and their knees are elevated. The second position is lithotomy position. And I consider this kind of the woman's visit position. So you're laying on your back and you kind of have your legs spread apart in the stirrups, your knees are flexed. There's a picture on page 77 of your book. The next is prone position. So you're basically lying with your stomach on the ground and your head is either facing down or to one side. So the key to the prone position is just your stomach is down. Orthopenia position is what I think of as the kind of hospital bed position or orthopedic position. You are sitting straight upright, kind of at a 90-degree angle, and there's a bunch of pillows behind your head or chest to hold you up. Recumbent position means that you are lying down in any position. Usually I think of there's something called a recumbent bicycle, and it's the one where you're, laying back and pedaling with your legs. If you're unfamiliar, do a quick Google search and it should help you remember the term. Sims position is a very special position. You're lying on your left side and your right knee is up, kind of up toward your chest, and your left arm is behind, parallel to your back. There's a picture of this also on page 77. And this position is most often used when doctors have to do maybe a spinal tap and get some spinal fluid, or they're doing some kind of examination on the spine itself. Supine position is the opposite of prone. You're just lying on your back and you're facing upward. The last one is a little tricky. Trendelenburg is how you say it. And you're lying on your back, but your head is lower than your feet. So you're kind of on a tilted plane, so your head is lower. This is oftentimes used when you need to get blood flow back to the head. The last major section in this chapter are the Abdominopelvic Regions and Quadrants. There are 9 abdominopelvic regions, so you kind of draw a tic-tac-toe board through the abdomen and you get these 9 regions. There's no specific boundary horizontally where these lines kind of cut across. But the first major section is the umbilical region. That's the middle there. It is around the umbilicus. Umbilicus is the fancy word for your belly button. And you can see in the picture the organs that are associated or lay under the skin of the umbilical region. On the right and left side of the umbilical region is the lumbar region. And it's called the lumbar region because that's where the lumbar vertebrae in your back are located. And this goes near the waist. Again, if you look at the organs underneath the skin there, it goes pretty much around your waist towards the top of your hips. I also want to draw your attention to the fact that we are referencing right and left. We're always using the reference from the patient's right and left, not ours as we are looking at the picture. So we're always going to notice how right is on the left side for us and the patient's left is on the right side for us when we're looking. The next region is the epigastric region. And if you think about what this would be literally translated, IC means pertaining to, epi means above, and we haven't learned this yet, but gastro means stomach. So it literally means pertaining to above the stomach, which is why that region is called that. To the right and left of the epigastric, we have something called the hypochondriac region. And if you think about what the word hypochondriac means now, it does not mean what it was originally intended for. Hypo means below, and chondro means cartilage. So the original meaning of hypochondriac meant below the cartilage or below the ribs. But this word has somehow evolved. So today we think of a hypochondriac as, a person who's afraid that they're going to get every disease or disorder. We even have something called a cyberchondriac, which are, those people who suddenly think they're going to get every disease or suddenly self-diagnose themselves by looking up on WebMD. So in this case, think of hypochondriac meaning below the cartilage, and in this case, cartilage is the ribs. The next one is the hypogastric. So similar to epi meaning above, hypo means below. So hypogastric is the region below the stomach. On the right and left side of the hypogastric, we have the iliac region. And it's pretty much called the iliac region because that's where your iliac bones are located. It's a bone within your hip, and so that's why those regions are denoted there. It's considered also near the groin region. There are 4 abdominopelvic quadrants, as the name quadrant implies. You are going to use the belly button or umbilicus as your center point, and you draw a vertical line down the midline and then a horizontal line across the body. Here's a picture of those 4 different quadrants, and they are pretty easily named once you get the hang of it. Again, note that we are using the reference of the patient's right and the patient's left. So you have the right upper quadrant and the left upper quadrant. You also have the right lower quadrant and left lower quadrant. On this slide, you'll also see that each one of those has a 3-letter abbreviation. So for example, we have right upper quadrant is RUQ. You will be responsible for knowing what those different abbreviations are. And these terms are mostly going to be used when different healthcare professionals are talking to each other, describing where a patient's pain might be if something is wrong. Here is a list of the abbreviations found in Chapter 3. There aren't too many of them, and 4 of them are from the quadrants that we just looked at. So if you can understand how they're named, those ones are going to be pretty easy. We also have anterior and posterior. So we have ant for anterior. Antero-posterior gets AP. We have inferior, lateral, medial, postero-anterior, and superior. So not every directional term has a abbreviation, but these are going to be the ones that are most commonly used. I would now encourage you to try the exercises on page 84 through 87. These are tying together all the different medical terms throughout the chapter and mixing them up. So it's one thing to be able to, put the words in a given exercise after you just looked at the chart for those words, but once they're all mixed together, it can be more difficult. This is the medical document found in exercise 23 on page 87. So in this exercise, again, you are supposed to practice just reading the medical document out loud and pronouncing all of these directional words correctly. It's one thing to know what they mean, but you will be responsible for pronouncing all of them correctly. Hopefully, as you read it, you will also be able to understand the context of the medical document that is being